I guess I'll get started here. I'll introduce myself. I'm Kristie. I'm a physiotherapist. I'm going to talk to you about injury prevention in cycling. And so we want to try to give you some techniques to help with some of that injury prevention. So I will go into a little bit of detail about myself. I am a physio. I actually work at the University of Regina, and I treat anything and everything. And I've been working in the profession for a while. I started going into specializing into concussions and dizziness. So I do a fair bit of that. But I also work in sport. I work with the Regina Thunder. And so I get to see some pretty interesting traumatic things as well. So it keeps my days pretty interesting. All right, so this presentation is actually provided by the Sports Med Science Council of Saskatchewan, and they're funded by the Sask lotteries. And they have some great programs. So if you guys are ever interested in seeing what else we can offer Cycling Saskatchewan, or maybe even some sports that your kids are involved in, or that your other sports are involved in and stuff like that, there's a lot of good medicine related programming as well as science related programming. So feel free to call the Sports Med Science Council if you have any questions or concerns. And we always want to make sure that sport is still fun. So if there's ever any issues with coaches, parents, other athletes that you're practicing with, there is contact or help out there if you need any. All right, so I was kind of given a topic and asked to present on it, and with some direction, but the more I looked into it, I definitely went down a bunch of rabbit holes, and eventually I came to this. So we're going to go over the different types of injuries that can occur, and then we're going to go into some of the rates, and then some specific injuries, and then as well as how to generally prevent injuries, and then going into some physical prevention. So I'm going to start off just explaining the different types of injuries. So I have categorized it into two. So you have chronic overuse, or these can also be considered insidious onset of injuries. And so they might have just kind of gradually came on. You didn't really know what was going on. Just all of a sudden your knee kept hurting after every bike ride. And it's now just there. It's always there. So that's going to be your chronic or your overuse injury. And I think we can all understand what a traumatic injury is. It happens when you fall off your bike, or somehow you maybe get hit while you're on your bike, or maybe you hit someone else. So typically something caused that type of injury. So incidents of overuse injuries. So we have found that there was some research that I found, and it's found that 85% of cyclists have reported an injury, at least one or more injuries that they have occurred because of cycling. And just under 40% of them reported that they were severe enough to actually go and seek medical attention. So here's a couple sites that are common injuries for overuse. Injuries within the cycling community: neck, knee, groin, hand, and lower back. I did find some good references as well, that actually most of them did say that recreational cyclists were more likely to hurt their knee, their back, and their neck. So this one is a little bit out of order from the rest of them. I just thought that it was really good because it had some stats. But in general, recreation cyclists tend to have more knee injuries, and then back, and then neck. And the thing is that generally we get a little bit more scared from traumatic injuries because they're kind of scary. We break bones, maybe it's a concussion. But the thing is that typically things that break actually tend to heal quite a bit quicker than something that's been already there for 2 or 3 months. And so you might actually recover from a broken arm quicker than, maybe an Achilles tendonitis or something. So traumatic injuries, here I have a little pictorial kind of showing the prevalence of or an incidence of the injuries within a traumatic cause, most likely in the upper limb. Some older research was actually showing that the upper limb injuries were more fractures, but now the newer research is showing that they're actually more abrasions than anything. And when we get talking into kind of learning how to tumble off your bike, this might make sense in that the recommendation is virtually trying not to put your arm out, and you're more likely to get an abrasion than a fracture. And so I think that advice that's been given is actually working, considering we're seeing more abrasions than the fractures when we're seeking medical care. So even though these are traumatic injuries, only about a quarter, up at the most a quarter of them are actually quite severe. So severe meaning fractures, head injuries, or anything that needs a lot of medical care. So we're going to go over some chronic overuse injuries, and we're going to just reiterate those common injuries that we see. This is just going by joint. But what I really want to point out is that we're all starting off with the poorly fit bike. And after that, then I kind of go into some issues with strength and core stability, sometimes range of motion. And so we'll go into detail more about that. And I really want to talk about that the commonality of this is that you really just need a good fitting bike. So that's a great way to prevent an injury. A good fitting bike will help with knee pain, low back pain, mid back pain, neck and shoulder pain, hand pain, foot pain, groin pain, and pretty much any other issue. So all that list that I showed you 2 slides ago about different joint injuries, if you have a good fitting bike, then it can help prevent these sort of pains. So what I want to go into is actually talking a little bit about bike fitting. I really went down this rabbit hole and probably spent way too many hours looking into this. But this is not a presentation on bike fitting, and it's definitely not my realm or my expertise. I can definitely look up all the research I want. But sorry, just one second. Martin.
I'm sorry.
Yeah, sorry. It's going to be, yeah. Sorry about that, guys. Okay. So bike fitting is very important. It's not my expertise. So it is very important. There's actually an International Bike Fitting Institute to definitely make sure that there's a good standard of bike fitting, as well as the people that are getting fit for bikes are getting it done properly, as well as those people are training to fit it. They're well trained. So my biggest recommendations is if your bike isn't fitting, you should probably get it fit. If it doesn't feel comfortable, then there might be something wrong. And even if you do get it fit, it's very possible that you have to go back and get it refit as well. You might have to just adjust to make it eventually be what you need. The thing is that bike fitting is definitely more of an art than a science. So like I said, the more I delved into it, it was definitely more, it's dependent on, measurements of your leg and your arm and where you sit within your inseam. And there's a lot of different measurements that they can take, but it also depends on your flexibility, your mobility, your strength, the type of biking you're doing. So it is a little bit more so art than actual science. So like I said, there's lots of ways they can do it. There's really no gold standard, other than there is kind of that International Bike Fitting Institute that does regulate an ideal way to bike fit. So I highly recommend getting someone to help you out. This can be going to one of our local bike shops and getting them to help you. This does cost money. I think it started at about $150 when I inquired. And they do some computerized assessment, 3D assessments, and then they can kind of fit your bike to there. If you go and buy a bike, I'm sure that everyone in here knows what I'm talking about. They'll kind of fit you just by some basic measurements, but there is possibility to go further and kind of pay for a really good bike fitting. Now, the thing is that if that isn't feasible, what you can do is you can try fitting yourself. You might want to find a buddy to help you fit that bike. And I hate to recommend it, but looking up some resources on YouTube, as long as they're kind of legitimate resources. I was looking for what was recommended to kind of lead you in the right direction. The International Bike Fitting Institute didn't actually have any videos, but they do recommend some bikes on their, or some books on their website. So if you are interested in learning how to fit a bike, you might want to check out some of those books. So common injuries we see with that overuse or that chronic, within the knee, we're most commonly going to see patellofemoral pain syndrome. That's kind of pain just right below the kneecap, or possibly an IT band friction syndrome. And there's actually a lot of other knee injuries that I came across, but the thing is they generally had the similar causes, and most of these causes were training errors, bike was set up improperly, and a big thing is kind of glute strength issues, so hip strength issues. Another thing that we can't really control or we can't really change is anatomical abnormalities. So really, recommendation there is you can't change how you're built, but you can definitely maximize your mobility and maximize your strength so that you're a lot more adaptable. So to help with, just to start going over that knee prevention, the biggest thing is get your bike fit. We kind of talked about that already. Make sure your training is very progressive. So work with your coach to make sure you're not going too quickly or progressing with too many hours, or you're sticking to trails that are within your ability. Another is you can always seek a medical or a physical assessment by a professional. So some, physiotherapists, athletic therapists, chiropractors, they will do kind of a functional assessment and kind of see where your weaknesses are, and kind of get you a good program from there. We'll talk a little bit about that later on. But the big thing is doing some hip strengthening. So we'll also get into that later. So common injuries in the lower back involve disc compression, kind of some traction or pulling on the joint capsules. So kind of that big fascial type of tissue around the joints themselves. And then also we can get muscle strains and ligament sprains within there, just because of that flexion posture in biking. There is quite a bit of evidence that's showing increased lower back rounding can increase low back pain. And it is recommended that if you have low back pain, that you do seek medical attention for it, just so that you can kind of get working on it and it can improve. So some of the prevention, so hopefully you don't have pain and wanting to try to prevent it. Of course, your bike fitting, proactively see a professional to get that physical assessment, but then also start working on your core strength training and your flexibility training. So neck injuries, typically we're going to see some postural fatigue, some muscle strains, and also some joint compressions, just because of that position for those road bikers. This is where those mountain bikers come in quite a bit, because they're likely bobbling around as well. And so a big concern is if your helmet is too big or too heavy, then that can definitely cause some muscle strain and other issues there as well. So that's where that neck and shoulder strength comes in. Limited in your neck range, as well as your mid-back range, can definitely affect the neck pain as well. And then, of course, equipment such as bike and helmet. So preventing that, we're going to emphasize that bike to fit, and then make sure that you can maybe check out other options regarding a lighter helmet if that is a concern. Once again, you can always check with a health professional and start doing things proactively. And it was found that commonly it was the upper trap in the levator that was at fault, and it was quite tight, or so we can do some stretches on that, and we do go over that in a bit. All right, so hand. Another common thing that I even see this one in the clinic quite a bit, some numbness and tingling into the hand, or even weakness into the hand after biking for prolonged periods of time. A lot of times this happens after you've increased your volume, or just in general, you're just going too long, and you kind of started, the season of biking started and you've just been doing quite a bit over a short period of time. This can be caused by shoulder strength as well as core strength, and of course, bike fitting issues. If there is any numbness or tingling into the hand, or even some weakness noted into the hand, it is recommended that you do refrain from cycling for a little while, unless you can offload those hands, just because the thing is, it is a nerve compression. And if nerves are compressed, the longer they're compressed, then there is possibility that it can lead to, prolonged recovery or other issues as well. So preventing those hands from irritating you, making sure you have equipment like gloves or padding, making sure that bike is fit. Often, or easy enough just to change your arm and hand positions frequently. And then, of course, we're going to talk about some shoulder and core stability training. So for just basic prevention in this chronic or overuse type of injuries, definitely work on that, getting your bike fit, using your proper equipment, and then making sure that you're using a proper plan to increase your volume or to change your trail usage and that sort of stuff. And of course, we're going to talk about it later, but working through some strength and mobility training. So traumatic injuries. Some of these causes, I do know that we're definitely not just talking to road bikers. We're definitely talking, as far as I know, any type of biker here. So the mountain bike and BMX as well. So, but of course, causes can be potholes, unpredictable terrain, having to go down a hill really, really quickly and needing to stop or turn. So maybe something that's unpredictable. Some other causes are mechanical issues. So if you're not maintaining your bike well, or possibly maybe your clip isn't coming out when you're trying to stop. Another concern is just other vehicles. So if you're doing any of the biking within the city, or even on highways and stuff like that, that it can be a concern. Sometimes injuries can happen with inexperienced bikers. So if they don't really know how interacting with other bikers works, so they might just be completely new, that could kind of put everyone at risk of injury as well. And of course, the higher speeds are more noted in road bikes versus mountain bikes, but of course those mountain bikers go pretty quick too. So we've seen this already, just reiterating that this can be fractures, organ injuries, head being concussion, facial lacerations and fractures, but biggest thing is abrasions and lacerations of those traumatic injuries. So I do want to talk a little bit into actual statistics. So after looking at all sport-related ER admissions, 13% of them were from biking of some sort. And this is bicycling of some sort, not necessarily motorbike. So that's pretty high considering we have other sports like football and soccer and hockey and, various other sports. So 13% is kind of high. But it's also found that the helmet has decreased concussion risk by 39% and facial injuries by 28%. I think I do have some other stats very similar to wearing a helmet as well. And I think they're higher, so they might be a little bit newer research, but we'll get to that. And you're more likely to actually get a head injury when you fall forward, but it also you can sustain a head injury if you are falling to the side as well. So you're not immune to a head injury if you go to the side. Neck injuries, this is going to be most common actually when you're falling forward over the handlebars. And a neck injury is the most common site of a spinal injury from cycling. So kind of just going into a little bit more information, falling over your handlebars, you're more likely to get a head or a neck injury as well as an abdominal injury. And then falling to the side, possibly a lower limb injury and abrasions. And so I did say that the most common injury for traumatic injuries are actually abrasions now. And like I said, some of the older research was actually showing arm fractures. So definitely, I think that's where the change has come with the tuck and roll. For lighter women, most likely they're going to go forward over those handlebars. And then, but even though that is a higher occurrence, there's actually more incidence of men having traumatic injuries between the ages of 20 and 39. So how do we prevent this? Well, first of all, we want to make sure that the cyclists are well trained. They're riding within their level of capability. They do know how to get off the bike safely. This is using getting out of their clips, or if they're mountain biking, sometimes they can kind of maneuver their way into a tuck and roll rather than just completely having their arms out. Of course, we want to keep that bike nice and maintained, but I'm assuming everyone here does that, right? And of course, we would want them to wear helmets and facial protection. So I did want to talk a little bit on falling. There's no perfect formula. It's all situational dependent. The idea is that we definitely want you to prevent you from going over the handlebars. So if you are applying your front brakes, the back tire starts to raise. I think that you guys all know this. And so you can try to apply your back brakes, which tries to avoid that unweighting of the rear tire. Another thing is trying to lean back as you're trying to, if you feel that back tire coming up. But the biggest thing is that if you're going forward, you tuck your head and your neck and you keep holding onto the bars so that you can kind of roll with the bike instead of trying to reach your arm out. So falling to the side, very, very similar. Don't put your arm out, kind of tuck in and kind of you're kind of rolling away from the road. And there was some stuff that I came across, those people that aren't clipping in, mountain bikers, BMXers, there was some techniques that can be used to try to train to dismount properly to prevent, like I said, having to have your hand out. But so you can kind of train to possibly save yourself in a fall, but I wasn't quite sure of how good that research was. But so that tuck and roll, if you're going to go over the bars, you want to tuck your chin, you want to hold onto the bars and just go, you're going to roll with it. So you kind of follow with inertia versus having your hands out and stopping that inertia. So here's where we end up with broken arms. Here's where we end up with abrasions. And that's kind of what we're talking about here. This is rolling with the inertia. This is stopping the inertia. And if you're going to go to the side, don't put your arm out. You kind of tuck and turn away from the road. So just highly recommending wearing that helmet. I think for the most part, this is really common. I actually was surprised to see it this much mentioned in the research, but definitely a good idea to wear that helmet. So here's where we actually get into what can I do exercise-wise, strengthening-wise to help myself prevent me from getting a ongoing chronic type of injury. And here, I just wanted to emphasize this little pyramid here. If we go here, so this is a very, very unstable. Most people that are recreational bikers, they bike because they like to bike. And so they're spending lots and lots of time biking with less time in the gym or working on their range of motion or their core control or their shoulder control, hip control. So if that's the case, we spend all our time on the bike with very, very little time working on ranges of motion. This pyramid it's designed to topple. So eventually it will topple. In other words, you will get an injury. And that's the idea. But if you have a stable base, so you've been working on your range of motion, you've been working on your control, then you're less likely to actually have injury because now you can spend the time cycling and be adaptive to what is going on. So I did kind of want to emphasize that everyone's a little bit different. So even though I am kind of giving some basic exercises to maybe even start off with, the thing is that everyone needs something different. So in reality, we do want kind of a nice even rounding of the back when you're on your bike. And so this guy is actually probably the closest that we would want to get to. So he has a nice rounding throughout the spine. Whereas we see this guy, he's super, super flat. Now imagine him on a bike and he'd be, I mean, he'd likely round as well, but let's just say he doesn't. His back would fatigue like crazy. So we would want to work on mobility through kind of his upper back and lower back. And then we have this individual here. So I should also mention, this guy is pretty flexible. This person, she's got no mobility through that back, and she's very unflexible. So, this individual would be working on a number of things to work on flexibility, mobility, and then likely strength as well. And then you go to the other spectrum. So we have this individual. So she's all loosey-goosey. She's got no problem. She's got a nice little rounding through evenly throughout. And so she's likely going to be in a good position on that bike. But the thing is that we can't guarantee that she's got a strong core and that she's able to support herself for that prolonged period of time. So, she might be an individual that we would concentrate more on core stability or hip stability, but definitely not flexibility. And then this individual, so she's only moving through mid back, and this is going to be pretty flat, even though you can't see it through her shirt. But yeah, she's definitely going to be flat through here and then quite rounded. So I think that this individual might even be at risk of a low back injury, but we would work on getting that low back mobility better. And then we would look into that and see what we can do. This last lady that I keep jumping around, but it's kind of telling a story here. What I liked about her is she's actually leaning back as well. So she does have a little bit of knee bend. So it almost looks like she's got some decreased hamstring length. But the thing is that she's leaning back. Compare this guy to this girl. And because she's bringing her hips back, she's actually loading those hamstrings really, really well. So, she might not be one that has that quad hamstring imbalance because she tends to load the hamstrings, but she might have some issues through her back because she's pretty flat as well. So whole point is that, everyone's a little bit different. There really is no recipe for, hey, this is going to prevent you from getting injured. It usually would be tailored to the individual themselves. Now, there's actually a lot of research out there regarding strength training and helping your biking ability. A lot of questions of, well, am I going to get bulky? I think everyone's always concerned about getting bulky with strength training. You're not actually going to get bulky. It just really, really helps with biking techniques. It allows you to be more adaptable on the bike. It gives you a freer range so that if you are fatigued, you're actually able to kind of at least adjust and work longer. So this guy, we also want to make sure that you're using the techniques properly so that can then transfer into your biking. But this guy, yeah, he's quite collapsed through that knee. And this is likely why he's getting knee pain. So we would want to fix that. And then he's got the rounded back as well. So possibly giving him some back pain as well. So this is kind of what we definitely don't want to do with our strength training. What exercises do I do? As I mentioned, this should be tailored to you personally. You would talk to a movement specialist, a physio, a chiro, an athletic therapist, and see if they can personalize a program. But, the whole point was the whole point of me here was to kind of give you some ideas to start working with. And so generally basics can be beneficial for anyone, especially if you're not doing anything, right? So if you're not doing anything other than riding your bike, you're going to get some benefits from doing some of this sort of stuff. So what equipment do I need? Basic stuff, you might need a foam roller, stretch strap, muscle release ball, maybe a dowel. I don't think, I think I did suggest an exercise with a dowel, but, pretty inexpensive equipment. But the thing is the more you become stronger, more specialized, you become in a higher level of your biking, you actually are going to require more equipment and maybe even a gym membership. I don't know. So our whole goal of strength training and working through our mobility is to have a good strength, good control, optimal range of motion, and just a high level of adaptability. There we go. So with this, it just allows you to work harder and be able to prevent fatigue. And usually when fatigue happens, that leads us to injuries. So we did talk about different joint injuries and the different types of injuries that can happen. But I just go into a little bit more detail about kind of some anatomical issues. So hip and knee pain can actually be caused by the hamstring tightness, poor hip flexor control. I think most of you bikers our cyclists understand that, the quad is very, very dominant in cycling. So we do kind of have that poor hamstring quad index. There we go. And then, of course, we've already seen that squat with that poor knee coming in. So decreased frontal plane control of that hip and that knee, that major causes of that knee pain. Ankle and foot. So a lot of times the shoes that clip in there, they're very, very rigid and don't really allow a whole lot of mobility through the foot, virtually no mobility through that foot. And if you're not able to bend your toe and you're kind of gripping through those toes, it can tighten the tissues on the bottom of the foot, can lead to some plantar fasciitis. And then as well, if you're not quite if you don't have your full ankle mobility, that can lead to ankle and foot pain as well. It can actually lead to knee pain as well, but I won't get into too much detail regarding that. Neck and shoulder, a lot of times we notice some decreased shoulder blade or just plain shoulder, just shoulder strength in general, but often shoulder internal rotation is limited. And with that head forward posture, there's usually poor neck control, so decreased neck stability as well. Upper and lower back, the biggest things we see is decreased core strength, some strength issues with your back extensors. Either they're overworking and they're weak, or they're just not working at all. And then, of course, that decreased mobility through your lower back and then your upper back as well. So how are we going to prevent injuries? Well, I did split this up into two different kind of categories. The first of all was your range of motion and mobility, and then your second was strengthening. Range of motion and mobility can be improved from either self-release techniques, or stretching, or some active mobilization exercises. So those self-release techniques, they're typically going to be done with a foam roller, lacrosse ball. These are great techniques to be used, and they've actually been tested and show really, really good results. There is some research showing that it's not actually changing the length of muscles or changing the length of tissue, but it definitely is making things more mobile. And the thing is that our tissues have so many layers of fascia, even between each and every little tiny fibril of muscle. And the thing is if that fascia is tight, muscles don't move very well, they don't contract as well. So that's usually what we want to do for the self-release techniques, is try to get that mobility through each and every single little muscle fiber. I think we all know what stretching is. This is kind of typically passive. Sometimes it's assisted as well. I only suggested kind of passive stuff. I didn't really give too many assisted stretches. And then active mobilization exercises. Sometimes these can be confused with a little bit of stretching, but you're more likely trying to go through a range actively or trying to lengthen a muscle actively, because if you are actually able to lengthen a muscle actively, that means you're actually able to keep it there for a longer period of time, which is actually more beneficial than just passively holding it there. So that's why these active mobilization techniques are quite valuable. So within that strengthening, I really just picked some exercises that are really, really good basics to start a good base. So there is so many progressions, and sometimes, I might have not started at the very, very bottom. So even if something is too hard, it's easily adapted to make it a little bit easier as well. So I did what I could. So mobility and range. We are going to kind of go through the three categories of each, the releases, the stretching, and then the mobilization. We're going to go through each individually for each joint. So your hip and your leg, those muscle releases. I'm not sure if any of you guys went to that warm up and cool down presentation, but I really hope that muscle release was kind of talked during that time. So I'm not going to talk too much about this. This is usually done with foam rollers. I usually recommend 30 seconds to 2 minutes per muscle group. And it really depends on, if you really don't have a tight calf, then you might not be working the calf for too long. But if you have a really, really tight glute, you might be working that glute for a little bit longer. So like I said, these muscle releases, I usually recommend 30 seconds to 2 minutes for each muscle group, depending on your symptoms and kind of your extensibility. Sorry, I'll actually go into detail. Here we're working the quads. Here we're working the IT band and kind of that lateral quad as well. And then into the buttocks is the glutes, and then anything that's going to be tight in that area. Working into the hamstrings and then the calf as well. So all good, great exercises to be doing. And, you know, you can do something like this super, super quick, even within, you know, 2 or 3 minutes. So stretching, I am just going to pull these up. General stretching for kind of the hip and leg in general. Here, I really like this because we're actually getting the hip flexor as well as the quad. And so it does give us a little bit of a deeper stretch, and always a beneficial to kind of hit 2 birds with 1 stone if you have that ability. Some people are very, very restricted and they might need to actually separate the 2 stretches. But like I said, these are good general stretches for most people. Here we have pigeon, definitely easily make it easier or harder. We're giving some hip extension on the one leg, but then we're also getting hip flexion and rotation on the other one. So it's a really good kind of hip opener stretch. And then hamstring as well. There's so many ways to stretch your hamstrings. And I know that in cyclists, hamstrings are a big concern. You know, this is not the only way to stretch a hamstring. I kind of like this one just because it does translate into one of the exercises that I'll be giving for strength. And then of course you can always go back into out to the side to stretch out the inside of the thigh. And then easy basic calf stretches. So this one is getting the muscle bulk, so that gastroc. And then here with that knee bent and leaning forward, we're actually getting into the soleus for that one. For stretches, I typically recommend, 30 seconds to 2 minute holds, 3 to 5 times. The most recent stuff that I've looked at is, we can't actually lengthen a muscle. The only way we can lengthen it is by actually improving the building block within the muscle itself. And in order for that to happen, you actually have to hold it for 24 hours. And so really what we're looking for with stretching is more increasing that muscle extensibility, kind of waking up those muscles, warming them up, not necessarily actually increasing the length. Over time, there will be gradual increases in length, but definitely not within just stretching it for 30 seconds. So here I go into some self-mobilization. So this is actually one of I really like this exercise. It's so great. Here it's actually actively stretching the hamstring while you're up in this position, and you're still kind of in that lengthened position of the hamstring here, but you're getting a great stretch while you're here. Not only that, it actually works on some hip flexion control. So commonly, because you guys are always, well, I don't want to just say always, because I know that not all bikers are in that flex position. But those of you guys that are in that hip flexion position, a lot of times there's very, very hip flexion control. And so that's why this exercise is so great. It does work on controlling through that hip flexion. It's also a really good core exercise. So we got the core, we got the hip flexion, we got the hamstring active stretch. And then not only that, but especially because you guys really aren't meeting that full end range quad. It's like, this is a quad end range contraction. And so what it actually is doing is it's taking it to that end range, and you're working and controlling through that end range. You guys have very, very strong quads, but the thing is not strong through the full range. So that's why it's actually hitting at that end range quad. So great exercise, highly recommended. This one, there's lots of things we can do to make it easier. This is kind of where it gets the hardest, but yeah, I just thought I'd post that one. Some self-mobilization through that quad itself. I really like this one because you are in you're kind of the lumbar region, so your low back is locked out by being in that elbow resting position. And not only that, you bring this hip forward, which also locks out that pelvis, so we can't cheat through this. So you're nice and locked out, there's no cheating. You're in hip extension. Cyclists don't really get into a whole lot of hip extension, so being able to reverse that mobility every so often is fantastic. So we got some hip extension. We have active hamstring contractions, so we're actually using that hamstring, and you're using it through range as well. So commonly we have a tendency to try to strengthen our hamstrings through our partial range. So because this is a mobilization technique, you're actually going through as much range as you possibly have. Sometimes the quad is restrictive, but for the most part, you're still kind of going through the general range. So here you would just bend that knee up as far as you can until you either feel tension through that quad or you're as far as you can go. And then you just lower it back down. So typically with these mobilization techniques, I usually recommend kind of holding for 3 to 5 seconds at each end and then going back and forth. I usually just stick with a simple 3 sets of 10. Everyone's different. Some people I give more, some people I give less. It really depends on the situation. But these mobilizations, like I said, holding at each end, 3 to 5 seconds, 3 sets of 10, simple. So we do a lot of hip stretching to get lots of rotation through the hips, but we never actually use that rotation. And so that's why this one's a really good one. We're just moving through that hip internal and external rotation. And it's actually quite beneficial. Once again, this can be done in a laying on your tummy so that your hips are in extension, because sometimes depending on the muscle length or the muscle in different positions, you might actually be more restricted in your range of motion when your hips are in extension. This is more functional for cyclists because you guys are typically in that hip flexion position. So it's more functional, but you might actually be more limited in that extension. So that's where your health professional might actually take you through this and decide, actually, you have pretty good control through your hip flexion and rotations. Let's try to get that control in that extension. So it would really be dependent on who's looking at you and what your plan is. So we have that self-mobilization through that ankle. This one I actually like. I would prefer if he dropped his bum so that he has a little bit more weight downwards. And the idea is that he actually is just rocking through this front leg to try to get a little bit more mobility through that ankle. And typically that is the ankle range that we're going to be missing. If we've had a chronic ankle sprain that we kind of just left, often we actually are stiff in our ankle, and it's usually in this mobility. And then also it does work through some hip flexion and some knee flexion as well. So you're putting your full body weight into this. And so it is quite a bit of pressure and going through that range. So it's a great exercise. So now we're going to move into that upper and lower back muscle release techniques. So like I said, this is the type of stuff that we would do, 30 seconds to 2 minutes per muscle group. And like I said, hopefully this has been discussed during that warm up and cool down discussion a couple nights ago. So first of all, we have kind of just getting a little bit more mobility through that thoracic spine. Here, this one's really good. It actually opens kind of the chest as well as the pecs. That's why I found that I was looking for the one with the 90-90. It gives us a nice pec stretch, but it also allows the ribs to kind of open up as well. It just reverses kind of that position that we're always in, either on the bike or even at your desk. A good lat release, and then going into the back. I do find it's really hard to release the muscles in the lower back with the foam roller. So I typically recommend using the ball for releasing the lower back. So just a couple stretches for that upper and lower back. I like going into extension because it's reversing what we're going to be typically doing on that bike. Yes, this is kind of the opposite of what I had said. Here you're going into that flexion, but you are getting that side flexion as well into that child's pose, which kind of opens up the ribs. It opens up all throughout the facets in the spine. And it also gives us a good stretch for that quadratus lumborum. So kind of that low back as well. And here we have kind of a whole rotational opening through lower back as well as upper back. Gives us a nice pec stretch as well. So we're kind of hitting one or two birds with those stones as well. So once again, stretching, we typically hold 30 seconds to 2 minutes, 3 to 5 sets. So now that mobilization of the lower back, here we just have a cat-cow. I actually use this exercise quite a bit because it does train our weaknesses. So here she's got some good extension through the whole spine. I wouldn't work through that one, but even in this picture, I'd be like, okay, we need to improve this. Kind of like my example at the very beginning, she gets all of her flexion in through her upper spine and then very, very little flexion through her lower spine. So I would be concentrating on trying to get some more pelvic rotation to try to get more mobility through that lower spine. So this is really good to get upper back, lower back mobilization on your own. Here we're actually locked out at the lumbar region, so the lower back. I usually get them to tuck in that shoulder real close because people have a tendency to try to just move through their shoulder to get this rotation. But the idea is you're opening up and you're opening that chest, and we get very little rotation anatomically through that mid spine, not only because of the joint orientation, but also because the ribs are in the way. But because we don't have that very much mobility, we tend to use it even less. The less you use it, the stiffer it gets. So that's why rotation through the mid back is actually super important. So this is a great one just to target that mid back, and it works really well. There's some really good adaptations to make it easier, make it harder, to assist it, to resist it. So this is a good way to start though. Here we're taking that rotation kind of through that mid spine, lower spine, as well as actually going all the way down into the hips. So, and it also tests your balance. I know that you're not standing on one leg on your bike, but the thing is that this just be kneeling on this one hip, it fires the glutes so well. And we've kind of already discussed that usually a glute weakness is noted, especially in cyclists. So here we actually get a really good glute contraction to stabilize that hip on that one side. And then you're also trying to stabilize and rotate. So we get a nice good control through that whole system, as well as rotation. So here we have just some hip flexion control. I kind of mentioned that a little bit earlier as well, that we do have some issues with hip flexion control, and here it just gives us a more functional position because we're almost into that biking position. So just kind of going into that bowing, keeping the dowel on the head, the thoracic spine, and then the sacrum as well. So trying to stay nice and upright as you're moving through that bow. So we're concentrating purely on that hip mobility. All right, so moving on to the next muscle group or next joint area, the neck and the shoulder. So muscle releases, going in and around that shoulder blade with lacrosse ball. I prefer lacrosse ball over a tennis ball. There's lots of muscle release balls out there. Cheapest option, lacrosse ball. But in and around that shoulder blade, you can get up into just above the neck or just below the neck as well. We can get into the pec area and then into the posterior shoulder as well. So great to keep that shoulder moving. And then the stretching. So as mentioned, I did find that most causes neck pain within cyclists was kind of decreased range in your upper trap and your levator. So here we have some stretches for that. Here's your upper trap, here's your levator. Pec stretch as well. And then this one I found specifically in a cycling reference, and to get that internal rotation of the shoulder. And so that's going to be for those guys that are in the gutter quite a bit and trying to work on that aerodynamics. So I tried doing this stretch. It hurts, but I think it'll be a good one and I might start using it. A super common thing in cyclists as well is kind of that first rib getting kind of stuck. So that first rib is that transition area from your neck into your upper back. And it's, of course, your first rib. So it can get pretty stiff, and it actually attaches onto a number of neck muscles as well. So any type of neck tightness can definitely stiffen up that first rib. So here we actually have a towel holding down that first rib. And then this guy is just moving his arm through the range as he's pulling down on the towel. It doesn't show it, but he's also trying to have a nice deep breath in as well, just because that rib does move with breathing. So he would move his arm as he's breathing and holding down that first rib. So he's breathing in as he goes up and then breathing out as he goes down. Another shoulder mobilization technique that I wanted to suggest was, I like this one. And even if you can kind of touch in the middle, so you do have really good mobility, but you just want to maintain it and make sure you have a good stretch, I would still suggest having something between your hands, like a towel or a belt, something that's nice and solid. And so here you would start by pulling down on the lower arm, which would cause the upper arm to go farther. And so holding 3 to 5 seconds, and then the opposite. So you'd pull up, which would pull this into more internal rotation, 3 to 5 seconds. And then you pull this down, which causes your upper arm into that external rotation. So you're just going back and forth. So of course you would have to get into a little bit, you'd have to switch arms as well. So then this arm would have to go on top, this would go on bottom. So, all right. So that was kind of the mobilization, stretching, and then self-mobilization techniques. Now we're going to go into some strengthening. The thing is that strengthening is such a huge topic on its own. Lots and lots of research in so many different populations. There is quite a bit of research in strengthening within the cycling population. Went down way too many rabbit holes, way too much detail. So I did still kind of stick with my path of giving you guys some really, really good basics with a couple hints along with it. The key is that we start doing some sort of strengthening if you're not doing any already, okay? So first of all, you guys definitely benefit from a squat. We already saw that that squat can definitely help with that hip control, so preventing that knee from coming in. And imagine you're actually on that bike and that knee's coming in with every single rep. Eventually that knee will get irritated. So if you build up that strength in those hips, that knee won't be coming in with every single pedal. And hopefully they stay in nice, in a good alignment. So a good squat is always a good option. The depth of this, that scared me. Is there a question? Okay, I'll keep going now that I'm not so scared. Okay, so the depth of the squat is actually dependent on your capability. So not everyone's going to squat to parallel. Some people might just, have a little mini squat to start off with. And we can start off with unweighted squats. We can start off with progressing into some kettlebell squats. There's so many different techniques and different beneficial squatting techniques that are good for cyclists. But it's simple enough just to start with a straight up squat. So squats are great. Now, a lunge. So within what I was looking into, I'm a fan of a lunge. It's a great exercise. It's great for some good hip stability. It's great for quad and hamstring co-contraction. It's, there's lots of good benefits to it. But the thing is that what I was coming across is actually using that lunge in a more functional position. So this is your traditional lunge. This is what I get most people to do. I want you to drop that knee straight to the ground and you get some good recruitment there. Here, this is great for a cyclist because this is the position that you're commonly in. You're kind of in that hip forward bent position. And so this is actually going to be more functional than this. So you might actually be standing up, but only in that hip flexion position, and then lunging down and then standing up. So working through this as a repetition versus this to just straight up standing. So lunging in a more functional position. I thought that was, that's a great suggestion to be working through, make it more functional to what you need to be able to do. Here we have a rear foot elevated squat. This one's great. Another way to get that glute firing a little bit better is single leg stuff. And a lot of times a single leg squat in general is, you don't have the control. So it's just a little bit too hard. Here we have kind of that glute firing, and it's keeping you nice and stable. And you can watch that knee as it tracks, over that second toe, and it's not coming inwards because you have a little bit of stability in the back. So a great exercise to be doing before you get into kind of single leg activities. But also this one is done within that kind of hip flexion posture that you would likely be doing while you're biking. So kind of taking a good traditional rear foot elevated squat and making it a little bit more functional for cyclists. Next, you can't go wrong with a good old clam. These exercises are great to either learn how to recruit the glute or just plain actually build up a little bit of strength. It's not very functional strength because it's not very often that we're sitting on our side like this, but it is a good exercise to start off with, to, like I said, to be able to learn how to recruit it and then kind of build that strength so that you can now learn how to recruit it in different positions. So clam, can't go wrong with it. This is also a really good exercise because it hits a whole bunch of points. The first being trending with the previous exercises, that hip stability. So your one knee is actually on a block, which elevates you. And then what you would do is making sure that you would elevate the other leg so it's in line with the other knee that is on the block. So this knee is kind of hovering in the air before it's coming out to the side. And the thing is that when we're in that position, immediately, if you're doing it correctly, you're going to start using a lot more core, and you're actually using a lot of shoulder stability as well. So you're kind of hitting that shoulder stability, the core stability, the hip stability. And then when you bring that leg out to the side, you're actually working on that hip abduction, which recruits a glute as well. So the glute med, which is typically a weak muscle that we see when we have that knee valgus, so that knee coming in. So once again, we're just hitting those glutes hard. Moving into the shoulder a little bit, noticing some shoulder internal rotation strength issues. So here we're actually into kind of, very commonly we tend to work rotations out to the sides like this versus here, because we tend to just use our shoulder in this position more. And in sports, we tend to be in this position going into that different rotation. So usually we're training it here. But the thing is with cycling, you need that internal rotation if you're going to lean onto your bars. So that's the idea, is you're coming into more of that shoulder flexion and then doing your rotations there, because it's going to be a more functional strength training position for you guys. All right, so this one, I did think, like, I wanted to put in a row and I wanted to make it a functional row. And from what I was looking at, what I would have changed with this exercise is I would actually probably take my bands or my pulleys or whatever, and I'd actually bring them down here. And so they were kind of more coming up. And then I would also put her in a more hip flexion position. So once again, we're working you in a more functional position. And then you're still working that row. And then just because we're going to bring the tension down so that they kind of have to work more up against gravity as well. So that's probably what I would do there. Having doing strength training, like upper body strength training in this half kneeling position, like I said, it's actually really good because you're really working that stabilizer. Putting yourself in this position with a narrow foot to knee, you really get some good hip stability recruitment. And so if you are doing any type of shoulder stuff and you really want to get more hip stability, and just choosing to do it in that half kneeling is always a good option. Okay, here's another good one that we tick off a couple boxes. So once we take that Bosu ball, put it against a wall, and then we back up into it. So our butt is now up against that ball. And once you push into that ball, it actually starts to recruit the core. It just turns it right on. And then because you're actually pushing back, you have to use your shoulders to push back. So once again, now you're actually using your whole shoulder girdle to stabilize that shoulder blade. And so then we take away one of your supports by lifting it. And now that opposite shoulder is really, really stabilizing, and it's working pretty hard. And I really like this type of thing for shoulder stability for you guys, because typically you guys are in a very one position when you're stabilizing. You really don't have to stabilize in these, outer ranges. So, having some sort of a closed chain exercise like this is actually quite a good option. So having your hands either on a bar, on the floor, is definitely going to help with being a little bit more specific to your sport, cycling. So I put this one at the end because once again, it is hitting a number of boxes, but I did kind of put a little bit of progression. So just starting off with a plank from your knees and your forearms, very functional in that you guys are going to be leaning through your forearms. The problem is that not super functional because you're going to be more into that flexion posture. But this is actually going to work through your back extensor muscles as well. So it's going to start turning on some of those muscles that we want to actually use while you're biking. And don't be scared to start here. I would prefer people to start here and do it well than to jump to this and have a saggy back or a butt in the air. So she does quite well. She does have a little bit of butt in the air, but I think that's actually how she's built. So I wouldn't want to fix this. So even though I say something about a butt in the air, she actually looks pretty good. I think it's just her anatomically, that's how she is. So once you're good at doing planks, and push-ups are always a good option. So you could probably even start doing push-ups early as long as you have good core control. This is really good because we're working through some shoulder stability, some core stability, and then we're also dealing with some movement as well. So, all right, I think, that was my last exercise. So like I said, I did try to do some pretty basic strengthening, but hopefully gave you enough tips that you would know what to kind of look for if you did want to start piecing some exercises of your own together, or if you start kind of looking into it, or maybe you might want to talk to a physiotherapist, athletic therapist, or a chiropractor about getting some sort of an assessment. Anyway, so what I would like you guys to take home from today is the importance of bike fitting. I want to say that, I think this is super, super common, and you guys already know this, and I'm just, beating a dead horse, but, it is quite important. In order to avoid some traumatic injuries, make sure you're wearing your helmet, make sure you're at least considering falling techniques, and kind of just be a smart biker. So know the rules and make sure that you actually know how to respond in unpredictable situations. Now, in order to avoid chronic overuse injuries, we do want to add in that regular mobility and strength training. So we want to make sure we have that good strength, good control, optimal range of motion, high level of adaptability, so that we can actually kind of broaden our ability on the bike versus just our very, very stationary ability. All right, that was all I had for you guys today.
Thank you very much, Kristie, for doing this for us. It's been wonderful.
Everyone needs to stretch more, Doug. All right, well, if there's no questions, I would just like to thank you guys for having me. And if you guys ever have any questions, I'm easy enough to Google, or you guys can ask for my email. but hopefully it was insightful and you guys got some good information. I'm going to stop sharing my screen now. All right. I hope everyone has a good night.
Thanks. Bye.
Okay, bye.